Hello, future occupational therapists. Welcome to a truly fascinating and rewarding area of your profession, hand therapy. Think about everything you do with your hands every single day. They are incredibly complex and delicate tools. When something goes wrong with them, it can have a huge impact on a person's life. This is where you, as a future hand therapist, come in. You have the amazing opportunity to help people regain their independence and get back to doing the things that matter most to them. Hand therapy is a specialized field of occupational therapy that focuses on treating conditions affecting the hands and upper limbs. This includes everything from the shoulder down to the fingertips. You might work with someone who has had an accident, like a broken wrist. You could also help people with long-term conditions like arthritis. It's a field that combines science, creativity, and a lot of heart. You will learn about the intricate anatomy of the hand, understand how injuries and diseases affect its function, and master techniques to help it heal. It's a journey of problem solving and making a real difference. As a student, you might feel a little overwhelmed by how much there is to learn. Don't worry, that's completely normal. We are going to break it all down step by step. This guide will walk you through the basics, from how to assess a patient's hand to the kinds of treatments you can use to help them recover. Think of this as your friendly introduction to a skill set that will make you an invaluable part of any healthcare team. You will be helping people button their shirts again, hold their children's hands, or return to a beloved hobby. The satisfaction you get from seeing that progress is truly second to none. So, let's get started on this exciting adventure together. We'll explore the tools you'll use, the techniques you'll master, and the communication skills you'll need to support your patients. Remember, every expert was once a beginner. The key is to be curious, ask lots of questions, and practice. By the end of this guide, you will have a solid foundation and feel more confident about stepping into the world of hand therapy. You are on the path to changing lives, one hand at a time. Let's dive in and unlock the secrets to becoming a fantastic hand therapist. Your journey with any patient begins with the assessment. This is your detective work. The initial assessment is all about gathering clues to understand what is going on with the patient's hand and how it is affecting their life. Your first and most important tool is your ears. You need to listen carefully to the patient's story. Tell me what happened to your hand. What are the most difficult things for you to do right now? This conversation, often called a subjective assessment, gives you vital information, pain levels, goals, daily struggles. This helps you build a picture of the person, not just the injury. Next, it's time to use your eyes. A thorough visual inspection is crucial. Look at the patient's hand and arm carefully. Are there any visible signs of injury? Swelling, bruising, pale, bluish tint scars, hand posture. All these visual clues can tell you a lot about the underlying problem before you even touch the patient. After listening and looking, you can begin the hands-on part of the assessment, with the patient's permission, of course. Gently feel the hand to check for temperature. Is it warmer or cooler than the other hand? This can be a sign of inflammation or poor circulation. Gently press to pinpoint tenderness or specific points of pain. This is called palpation. Bones, tendons, ligaments. Always be gentle and watch the patient's face for any signs of discomfort. Finally, you will start to assess function. This involves asking the patient to perform some simple movements. Can they make a fist? Can they open their hand flat? Can they touch each fingertip to their thumb? These basic movements give you a quick snapshot of their range of motion and coordination. Once you have a general idea of your patient's movement, it's time to get specific and measure it accurately. The main tool we use for this is called a goniometer. It's really just a special kind of protractor for measuring joint angles. It has two arms, the stationary arm, moving arm, and a circular dial with angle markings. Learning to use a goniometer is a fundamental skill in hand therapy. It gives precise, objective range of motion measurements. Example, measuring the MCP joint. First, know your landmarks. Place the fulcrum directly over the joint. For the MCP, on the back of the hand, over the knuckle. Align the stationary arm with the metacarpal bone. Align the moving arm with the proximal phalanx, the first bone of the finger. Ask the patient to move the joint as far as they can. For example, ask them to bend their knuckle. Move the goniometer's moving arm to follow the bend, keeping fulcrum and stationary arm steady. Once maximally moved, read the number on the dial. That number is the joint angle, the range of motion. Measure for bending and for straightening for each joint you assess. Be consistent with landmarks every time. Consistency makes measurements reliable and lets you track progress. After measuring how much a hand can move, the next big question is, How strong is it? Strength is essential for almost every task. In hand therapy, we measure two strengths: grip strength, pinch strength, gold standard for grip, dynamometer, patient squeezes the handle, device reads pounds or kilograms, standard procedure, patient seated, feet flat, shoulder adducted, elbow 90 degrees, forearm neutral like a handshake. Hand them the dynamometer, instruct a maximal squeeze for a few seconds, take 3 readings per hand, calculate the average. 3 pinches we test: tip pinch, tip of thumb to tip of index finger; key or lateral pinch, pad of thumb to side of index finger like holding a key; palmar pinch, pads of thumb, index, and middle fingers together. Use these numbers to set specific, measurable goals and clearly demonstrate progress over time. A hand that can move and grip is great, but without sensation, it's not fully functional and can even be unsafe. Sensation is our hand's alarm system. It tells us if something is too hot, too cold, too sharp. It also gives us the delicate feedback needed for fine motor control. Imagine trying to button a shirt without being able to feel the button or buttonhole. That's why assessing sensation is a critical part of a complete hand evaluation. One of the most common ways to test for sensation is using a set of tools called Semmes-Weinstein monofilaments. These look like little fishing lines of varying thicknesses attached to plastic handles. Each filament is calibrated to bend at a specific amount of pressure. The test helps you map out exactly which parts of the hand have normal sensation, reduced sensation, or no sensation at all. To perform the test, you ask the patient to close their eyes or look away. You then touch the filament to their skin until it bends, hold it for a second, and ask them if they felt it. You start with the thinnest filament, which represents normal sensation, and touch it to different zones on the palm and fingers. You must have a good knowledge of the sensory nerve distributions of the hand to understand the pattern of any sensory loss. If the patient can't feel the thinnest filament, you move up to the next thickest one, and so on. You record your findings on a diagram of the hand. This creates a detailed sensory map. Another important test is for 2-point discrimination. This assesses the ability to tell if you are being touched by 1 point or 2 points. With the patient's eyes closed, you lightly touch their fingertip with either 1 point or 2 points and ask them what they feel. Good 2-point discrimination is essential for tasks that require fine tactile feedback. Once your assessment is complete and you have identified the key problems, it's time to move on to the intervention phase. This is where you actively help the patient improve. One of the cornerstones of hand therapy is therapeutic exercise. These are not just random movements, they are specific, targeted exercises. Increasing range of motion, building strength, improving coordination. The exercises you choose will depend entirely on the patient's condition, the stage of their healing, and their personal goals. For a patient who has a stiff hand after being in a cast, the initial goal will be to improve their range of motion. You would start with gentle exercises. For example, tendon gliding exercises are fantastic for getting the tendons moving smoothly again. Straight hand tabletop hook, fist full fist back to a straight hand. Each position is held for a few seconds. Once motion improves, you can start to focus on building strength. This should be done gradually to avoid re-injury. You can use simple tools like therapeutic putty, stress balls, elastic bands. For example, with therapy putty, you can have the patient perform different actions like squeezing the whole ball for grip strength, pinching off small pieces for pinch strength, rolling it into a long snake to work on finger extension. You can choose different colors of putty, which correspond to different resistance levels, from extra soft to extra firm. It's also crucial to include exercises that work on fine motor coordination and dexterity. These are the exercises that translate strength and motion into functional skills. Picking up small beads, turning nuts and bolts. The key is to make these exercises meaningful and, if possible, related to the patient's hobbies or daily tasks. Always remember to educate your patient. Explain why they are doing each exercise and show them how to do it correctly. A home exercise program is vital, so give them clear written instructions with pictures to follow between therapy sessions. Sometimes exercise alone is not enough. In hand therapy, we often use splints, also known as orthoses, to help our patients. A splint is a device worn on the hand or arm to support, protect, or correct a joint. As an occupational therapist, you might learn to make custom splints from special thermoplastic material. You heat this material in warm water until it becomes soft and pliable. Then you mold it directly onto the patient's hand to create a perfect custom fit. Sometimes we use a splint to completely immobilize a joint to allow a fracture or repaired tendon to heal. This is called a static splint. Other times we use splints to help increase range of motion. These are called dynamic splints. Beyond formal exercises and splinting, a huge part of your job is being a creative problem solver for daily life. This is where the occupation in occupational therapy shines. You help patients figure out how to do everyday activities safely and independently. This might involve teaching new ways to do things. For instance, teach someone with painful arthritis how to open a jar using pressure from their palms. You can also introduce them to adaptive equipment. Button hooks for doing up shirts, long-handled shoehorns, special cutlery with large built-up handles that are easier to grip, electric can openers, or jar openers. Part of your role is being a resource, knowing tools and helping patients choose what's useful. Your goal is to empower them to participate as fully as possible in their own lives. Remember to document everything you find. Write it down clearly and systematically. This detailed record is the foundation upon which you will build your entire treatment plan. It's the map that will guide your therapy journey. As you embark on your journey in hand therapy, remember that your technical skills are only half of the equation. The other half is your ability to communicate effectively and to build a strong therapeutic relationship with your patients. Healing is a partnership. Your patient needs to trust you and feel on your team. Always introduce yourself clearly. Explain what you are going to do before you do it. Listen more than you talk, especially in the beginning. Their story holds the key to recovery. Safety must be your top priority, for the patient and for you. When performing assessments or interventions, be gentle. Watch nonverbal cues. A wince or sharp intake of breath can tell you more than words. Never push a patient through pain. Be mindful of infection control. Wash your hands before and after every patient. Keep your equipment clean and sterile. Never stop learning. The field is always evolving. Read journal articles, attend workshops, talk to experienced therapists. Find a mentor. The more you learn, the more tools in your toolkit to help patients. Your education is lifelong. Keep growing. Be patient and celebrate small victories. Recovery can be long and frustrating. There will be good days and bad days. Be a source of encouragement and support. Celebrate every degree of motion gained. Celebrate every ounce of strength restored. Celebrate every functional task they can do again. You have chosen a profession that can give people back their lives.